Welcome to the 2021 Open Enrollment Informational Session for active employees. Today, we will be highlighting some very important information regarding this year's annual open enrollment. This presentation is a brief summary and does not constitute a legal document or contract and is subject to change. Topics for today include open enrollment, important dates and form submission deadlines, online resources, COVID-19 coverage, virtual fair and other EUTF website resources, plan changes, health plan benefit and premium contribution changes, health plan selection, knowing what to consider when selecting a health plan, enrollment form, completing and submitting forms for open enrollment, and money saving tips and wellness programs, identifying ways to reduce costs and stay healthy. Open enrollment. Important dates. The election period is from April 1st, 2021 and has been extended to May 14th, 2021. Employees who wish to enroll or make changes must complete and submit an EC1 or EC1H for those enrolled in HSTA VB benefit plans, enrollment form, and any required proof documents to their Departmental Human Resource Office, County Personnel Office, DOE EBU for DOE employees, or enrollment designee. For employees who do not want to make changes, no action is needed. Enrollment forms received on or before the deadline will be processed during the months of May and June. Once the enrollment form is processed, a confirmation notice will be mailed to the employee. If they do not receive a confirmation notice by the end of June, please have them contact the EUTF. If the employee is not enrolling or making changes during the election period, they will not receive a confirmation notice. The new plan year for active employees begins July 1st and continues to June 30th the following year. All changes made during open enrollment will take effect July 1st. Any health plan changes, including new premiums and rate changes, will also take effect July 1st. Online resources. Visit our website at eutf.hawaii.gov to get the latest information on COVID-19. Learn about health service options, coverage for COVID-19 testing, treatment, and vaccinations, how to seek health services, and information on how to prevent the spread of COVID-19. This year, we are offering a new way to attend open enrollment. The EUTF Virtual Fair gives employees access to the same information normally available at our open enrollment informational sessions, but from the privacy and safety of their workstations or homes. Click on the latest information on health plan enrollment, benefits, premium information, as well as any upcoming changes for the new plan year. EUTF members can participate in live webinars, watch informational videos from each of the health carriers, and access important open enrollment forms and documents. Virtual Fair Login. To attend our virtual fair, simply log on to eutf.hawaii.gov/learning center. Click on Active Employee Open Enrollment Fair. Virtual Fair Room Access. Participants will need a computer and internet access to attend. For the best experience, use an up-to-date version of Google Chrome, preferred, Safari, or Firefox from a desktop or laptop. Website Active tab. Under the Active Employee tab, browse through links to our Open Enrollment Checklist, EC1 and EC1H enrollment form, our new 2021 Employee Health Benefits Reference Guide, the most current premium contribution table, and our popular Premium Calculator and Plan Finder tools. Thinking of retiring soon? Our pre-retirement informational session webinar gives members important information on enrolling in EUTF retiree plans, Medicare Part B premium reimbursement, base monthly contribution calculations, the various health plan options for retirees, required forms and documentation, and offers a Q&A session at the end. The EUTF is pleased to announce our ongoing efforts towards implementing a new benefits administration system. we would like to give a brief overview of the new benefits administration systems, employer portal access, member and retiree self-service, and our implementation project timeline. The employer portal access will give employers access to view a member's demographic, employment, and current benefit coverage and costs, as well as history, member life event history, coverage changes, for example, view employer invoice and remittance payment, secure messaging with EUTF, access to standard reports with export to Excel, transmit HR files securely through portal or SFTP, and upload documents to the EUTF. The member and retiree self-service portal provides a snapshot of your current coverages and premiums, secure messages with the EUTF to protect your information, online open enrollment and life event changes, and upload supporting documents for faster processing. Our implementation project timeline consists of 5 phases. Project start date with EUTF's implementation of Morneal-Chappelle's Aerial Benefits Administration System began on June of 2020, with our go live target date set for February 1st, 2022. Plan changes. Effective July 1st, 2021, HMSA plan changes are as follows. Excluded the bariatric surgery out-of-network benefit for the EUTF HMSA 7525 active employee plan. Subjected out-of-network mammography screenings to the deductible for the EUTF HMSA PPO active employee plans. Added the medical nutrition therapy benefit at standard in-network and out-of-network coverage to the HSTA VB HMSA active employee plans, and increase the member cost share from $20 per session to the plan's standard in-network coinsurance, example 10% of eligible charges under the 90-10 plan, and narrow the eligibility criteria for Dr. Ornish's program for reversing heart disease under the EUTF and HSTA VB HMSA active employee plans effective January 1st, 2022. Kaiser plan changes include increase the member copayment from $10 to $20 for basic laboratory tests and general imaging under the EUTF Kaiser Permanente standard plan. The facility-based diabetes prevention program ended 12/31/2020 under the EUTF and HSTA VB Kaiser Permanente active employee plans. Applied a zero copayment for the following preventive screenings and lab tests for members diagnosed with specific chronic conditions under the EUTF and HSTA VB Kaiser Permanente active employee plans effective January 1st, 2021. A1C testing and renopathy screening for individuals diagnosed with diabetes, LDL or low density lipoprotein testing for individuals diagnosed with heart disease, and INR International Normalized Ratio testing for individuals diagnosed with liver disease and or bleeding disorders. CVS prescription drug plan changes includes increase the maximum out-of-pocket for the EUTF PPO 7525 active employee plan to $3,150 per person and $6,300 per family effective January 1st, 2021. Excluded Glumetza Metformin ER modified release tablets and Fortamin Metformin ER osmotic tablets and their respective generic formulations from all EUTF active employee drug plans effective January 1st, 2021. Added coverage for exmestane 25 mg and anastrozole 1 mg at zero copay for women 35 years or older when verified that the medication is used for breast cancer prevention. Members must use an exception process to validate preventive use. Update the coordination of benefits for secondary card holders. Copays may be subject to change. EUTF premium and contribution changes. Employers and unions are in negotiation to establish employer-employee premium contributions. Employer premium contribution amounts for July 1st, 2020 to June 30th, 2021 will be used until an agreement can be reached. Active employees should pay special attention to the premium rates, which will be posted on our website at eutf.hawaii.gov. Health plan selection. When selecting a health plan, there are a few things you want to consider. Premiums are the monthly amount paid for your health insurance shared between the employer and the employee. You would want to consider the premium amounts of the plans you're selecting. Deductibles. Consider whether your health plans have services subject to a deductible, and be sure you understand how they work. Deductibles do not apply to all plans or all services. They cannot be paid in advance and are renewed annually. Deductibles must be paid each calendar year on a claim-by-claim basis before benefits subject to the deductible become available. EUTF benefit renewals based on either a calendar year or plan year. A calendar year runs from January 1st to December 31st. Plan year runs from July 1st to June 30th. Plan year benefit renewals includes dental and vision benefits. EUTF members experience a higher level of benefit when they receive service from in-network providers, including in-network physicians, hospitals, pharmacies, and other providers contracted with your health insurance. Although some EUTF coverages offer out-of-network benefits, these are providers that are not contracted with your health insurance carrier, the benefits are almost always lower than seeing in-network providers. To maximize your benefits under your EUTF coverages, you would want to see in-network providers. Co-insurance and co-payments. Co-insurance and co-payments represent your out-of-pocket costs for covered expenses. Co-insurance is your out-of-pocket based on a percentage. Co-payments is out-of-pocket costs based on a fixed dollar amount. Maximum out-of-pocket, sometimes referred to as the MOOP, is the maximum amount of co-insurances, co-payments, and deductibles you will pay for covered medical and prescription drug costs within a calendar year. The maximum out-of-pocket is your financial protection against a catastrophic injury or illness. All covered co-insurance, co-payments, and deductibles apply towards your maximum out-of-pocket. Starting at the beginning of the calendar year, your insurance company will keep track of your out-of-pocket co-payments, co-insurance, and deductibles you've paid out. Below is the maximum out-of-pocket amounts for HMSA and Kaiser plans. Please note the differences between each plan. When the maximum out-of-pocket limit is reached, all services thereafterwards would be covered at 100% by your insurance for the remainder of the calendar year. Keep in mind that members are still responsible for taxes and other non-covered services. The benefit resets every calendar year. The following are some examples to help clarify some of the terms we've gone over. Rick is considering enrolling in either the 90-10, 80-20, or 75-25 HMSA PPO plan for himself. Here are the annual premium amounts, which is the monthly premiums multiplied by 12 for the 90-10, 80-20, and 75-25 plans. Please note that these are the current premiums as of the making of this video. Rick anticipates 4 doctor visits during the calendar year. His doctors charge $100 per visit before insurance pays. Total $400. Under the 90-10 plan, Rick's coinsurance is 10% or $40. Both deductible and maximum out-of-pocket do not apply. Total estimated annual cost is the annual premium amount plus the 10% coinsurance listed at the bottom in green. Under the 80-20 plan, Rick pays a 20% coinsurance along with a lower annual premium amount, showing a lower estimated annual cost if he selects the 80-20 plan in this scenario. The 75-25 plan has a 25% coinsurance in addition to a $300 annual deductible per person on the plan that must be satisfied before benefits that apply to the deductible are paid. However, physician visits do not apply to the deductible. Therefore, Rick's total estimated annual cost under the 75-25 plan would be the coinsurance plus annual premiums, making the 75-25 plan the plan that offers Rick the most savings in this scenario. Let's try the same scenario again, but with a higher medical expense. Here Rick anticipates $19,100 in covered in-network medical expenses, with $300 subject to the 75/25 deductible from January 2021 to April of 2021. For the 90/10 plan, we have a coinsurance plus annual premiums. Under the 80/20 plan, the 20% coinsurance totals $3,820. Rick will not pay $3,820 because the maximum out-of-pocket for the 80/20 HMSA plan for single is $2,500, which is the most Rick will pay in covered coinsurance and co-payments within a calendar year. Any amounts over the maximum out-of-pocket is paid for by the insurance company. So for the 80/20 plan, the total will be the annual premiums plus the maximum out-of-pocket. Under the 75/25 plan, we have a 25% coinsurance. However, Rick's medical expenses are subject to a $300 annual deductible, and since the deductible must be satisfied before benefits that apply to the deductible can be paid, we will start there. $300 minus the $19,100 equals $18,800, of which 25% will be Rick's coinsurance. In addition to the $300 deductible, total out-of-pocket cost for Rick is $5,000, which is also the 75/25 plan's maximum out-of-pocket amount for single. Total estimated annual cost, including the annual premiums plus the $300 deductible and the 25% coinsurance, makes the 75/25 plan the plan offering Rick the most savings in this scenario. In our last example, Malia is considering enrolling in the Kaiser Comprehensive or Standard plan for herself only. The annual employee premiums are listed here. Malia will undergo surgery and was told the cost before insurance could be $50,000 at an in-network Kaiser facility this year. Under the Kaiser Comprehensive plan, surgery and hospitalization are covered at 100%, so Malia will only be responsible for her annual employee premium contribution. Under the Kaiser Standard plan, surgery and hospitalization is subject to a 15% coinsurance or $7,500. Malia will not pay $7,500 because the maximum out-of-pocket under the Kaiser Standard plan limits her out-of-pocket to $2,500. Therefore, Malia will be responsible for her maximum out-of-pocket and her annual employee premium contribution, making the Kaiser Standard plan the plan offering the most savings in this scenario. Enrollment Form. Completing the EC1 form. Under Employee Data, all applicable fields must be completed. Under Coverage Start Date, please leave this section blank. Under Plan Selection and Contribution, employees must check the box of each plan they wish to enroll in or continue to be enrolled in. Note, they may enroll in only one medical prescription drug plan. A spouse or partner and/or dependent child may enroll in the same plans as the employee, but may not enroll in health plans on their own. Life insurance is 100% employer paid and is available for the employee only. Dependent information. List all eligible dependents, including spouse or partner, who will be enrolled in plans. Dependents are being enrolled in EUTF plans for the first time. Please submit the following proof documents. Required proof documents based on enrollment type include: for self plans, no proof documents required. Adding a spouse or partner, marriage certificate, domestic partnership, notarized declaration of domestic partnership, affidavit of dependency and acknowledgement, and 2 sets of required verification documents. Visit eutf.hawaii.gov for more information. Adding a dependent child, birth certificate, or guardianship decree if legal guardian, or adoption decree if child is placed for adoption or adopted. Dependent children aged 19 to 23 who are full-time students and enrolling in dental and vision plans, we need student certification letter or a letter from the school's registrar or verification certificate from the National Student Clearinghouse. Transcripts and class schedules are not accepted. Under Other Insurance Information, employee must complete this section if they or any of their dependents are covered under a non-EUTF health plan. Employee signature. Employees must sign and date the form by May 14, 2021. Enrollment forms must be submitted to Departmental Human Resource, County Personnel Office, DOE EBU, or Enrollment Designee by May 14, 2021. All proof documents must be received in order to process enrollment changes. Confirmation Notice. Employees who submit their completed form and proof documents on or before the enrollment deadline will have their forms processed through the months of May and June. If employees do not receive a confirmation notice by the end of June, please have them contact the EUTF. If they are not enrolling or making changes during the election period, they will not receive a confirmation notice. Employees will use the corrective action form provided with the confirmation notice to notify EUTF of any EUTF data entry errors. Money-saving tips and wellness programs. Tips on how to save money. With healthcare costs continuing to rise, here's some tips on how you can save money. Choosing a plan that's right for you. Not all plans are created equal. Just because a plan has the highest monthly premium does not mean it will be the most cost efficient. Be sure to factor in your cost share, deductibles, co-payments, and co-insurance, monthly premiums, calendar and maximum out-of-pocket, and your expected usage for the year before making any plan decisions. Every year, Open Enrollment offers an opportunity to choose a plan that best suits your needs, which may change from year to year. Picking the right providers and facilities. Going to a non-participating doctor can be, in some cases, more than twice as expensive as going to a participating provider. Seeing doctors in your network is an easy way to keep your costs low. If you have a nagging cough, do not go to the emergency room. The ER should be reserved for serious emergency situations. If you have a non-emergent illness or injury, go to your regular doctor or an urgent care facility. Cost savings can be significant. Choosing generic when available over brand name can save you money. Generic drugs contain the same active ingredients and can cost 3 to 4 times less than their brand name drug equivalent. Check with your doctor if generic alternatives are available for you. Use mail order for maintenance drugs. Can save you time and money. Having your maintenance medications mailed to you can save you a trip to the pharmacy every month and allow you to pick up a 3-month supply for the cost of a 2-month supply. Contact CVS or Kaiser today to get started. Wellness programs. The EUTF encourages you to be well, be strong by taking advantage of the wellness programs available through your health plans. Getting your annual physical exams and screenings can help with early risk detection of illness and disease. If you're thinking about quitting smoking, our plans offer tobacco cessation products and programs, including telephonic counseling to help you kick the habit. Disease management programs help EUTF members who suffer from chronic conditions find information, support, and programs that help members better manage their conditions. And health coaching is available to help members start an exercise program or would like help with meal planning and eating healthier. Health risk assessments are available online to members to help begin the process of getting healthy and staying healthy. Reminders. Deadline for employees to submit EC1 or EC1H forms to their Departmental Human Resource, County Personnel Office, DOE EBU, or Enrollment Designee is May 14, 2021. If you are adding dependents, all proof documents must also be received by May 14, 2021 in order to process enrollment changes. All changes will take effect July 1, 2021, and for employees who do not want to make changes, no action is needed. This concludes our presentation for today. We hope our presentation was informative and helpful. On behalf of the EUTF, mahalo for your time and attention.